Hi there, I am Cassie Lee. I am an account manager with Cornerstone Environmental Health and Safety. And we've been working with clients over the last 5 months during their shutdowns and returning to work after the COVID quarantine and isolations. And after 5 months of working with industry to help mitigate the spread in the facilities, we've seen a recent uptick in folks asking for help. And so we decided to provide a high-level overview of an effective program. So this video is going to focus on the industrial sector. And so you're looking at low, medium, and high-risk employees. We are steering clear of the very high-risk employees, which might include your healthcare workers and medical community. We are just not experts in that realm, so we're going to steer away from it. So so let's get into it. So the first thing you want to do as part of your effective program is create a pandemic response team. So ideally, this is a cross-functional team consisting of members from different areas of your facility. So various employees, supervisors, HR, personnel, EHS managers, leadership, union leadership, if that applies in your facility. So you, by way of example, I have drawn up a lovely org chart for you. Again, I'm an account manager. I'm not in marketing. I'm not in graphic design. So bear with me in my org chart and what I'm capable of, which is a really good stick figure person. So an example of what your pandemic response team might look like is something to this effect. So let's see here. Okay, perfect. All right, so you want to create your employee access control lead, your virus prevention and protocols lead, your sanitation and disinfection lead, communications and training lead, super important, and PPE lead. And again, all these report back to the site manager. So again, example of how your pandemic response team might be set up. Your team could look completely different based on how your program is set up. So, but a full program addressing the various aspects of returning to work should be taken on by this team. And of the utmost importance to this is doing risk assessments of all employees. So key personnel from all employees of your operation, right? So another big part of that team is putting together a schedule of communications internally, virtually, right? So we all adapted to that pretty quickly. I know at Cornerstone, as soon as we went into quarantine, we were on Microsoft Teams and Zoom and communicating virtually so as to socially distant, right, from one another. So let's talk about assessing risk. So per the OSHA guidance, one of the most important components to returning to work is assessing the risk of different employees. So in all facets of the operation, and starting with how your workers enter the building, all the way through to how they leave at the end of the day. So it includes workstations, lines, administrative staff, and break rooms, lunches, locker rooms, lunch spaces, shipping and receiving, and looking at different areas. So I would be considered a low risk employee. I work in a cubicle. A lot of my colleagues here in the office work in their own office spaces, therefore creating our own physical barriers in those spaces. And we're able to distance from one another because of that. So office workers, administrative staff are examples of low risk employees. Medium risk employees are more like your person at the entrance scanning folks for temperatures, people that are working closer in proximity to one another, that 3 to 6 feet range or under. And then high risk would include your EHS staff or first responders to folks that are potentially infected. So controlling risks. Next up, looking at the OSHA hierarchy of controls, ways to control risks with COVID, engineered controls, right? So isolating the worker from the hazard, creating those physical barriers, reconfiguring workstations. Your next would be administrative controls. So the way the work is performed. staggering breaks, staggering schedules, virtual communications, limiting non-essential work travel, things like that. And then finally, PPE controls, which is obviously your masks, gloves, shields, things like that. So next up on our docket is the risk level and how that might apply to your engineered controls, right? Another one of my wonderful illustrations. And you can kind of see where these come into play at different risk levels. So with your low risk, I'm going to peep over this because technology, not my thing. Low risk, engineer controls, not really necessary, right? I'm sitting in a cube. I'm sitting in an office. Right now I'm sitting in a conference room. Administrative controls. I know here in the office, we've put signs on most of our rooms. For instance, this conference room is normally an occupancy of about 6, but with social distancing, it's now at 3. So outside the door, there's a sign, occupancy level 3. Our printer room is pretty small, so only one person is allowed at a time. Things like that. COVID training is going to be universal across the board. And then PPE controls, not really necessary for your low risk employees. Unless they're leaving that isolated area, that barriered off area. I know when we get up from our desk now, we are wearing our face coverings. So, medium risk. Your engineered controls include installing physical barriers or reconfiguring workstations. Administrative controls can be back to that staggering the work schedule, practicing social distancing, job-specific training. And then your PPE controls are going to be your face masks. That's right, I drew that. High-risk employees get a little bit more serious here. So installing physical barriers, improving ventilation, creating isolation rooms. Administrative controls include job-specific training, signage and markings. And then with our PPE controls for our high risk, we're a little bit more stringent here. Gloves, gowns, face shields, even respirators, and then alcohol decontamination with a 60% or better solution. So again, my lovely color-coded charts. Next up, we want to talk about our prevention protocols and what that looks like. I've gotten really bad about touching my face, and I think about it more now that all the guidelines are out. So we found these to be common categories in successful programs. So first off, your inventory of your materials. So do you have hand sanitizer? Do you have tissues? Do you have face masks, safety gloves, disinfectants, and cleaning supplies? Touchless thermometers, things of that nature. Take inventory. Next would be your personal protective equipment, your PPE protocol. So ever changing, ever controversial. Face coverings, right? So even just last month, CDC kind of changed their direction on this. So CDC recommends wearing face coverings as a protective measure in addition to social distancing. And those cloth face coverings become especially important when you can't social distance and where it's not feasible based on working conditions. Keep that in mind. Disinfection measures and schedule protocol. Social distancing protocol. So in the workplace, working less than 3 feet between coworkers should be avoided when possible. But if it's not feasible, then the risk evaluation becomes even more critical, and using those engineering controls, such as that physical barrier, to limit exposure. Between 3 and 6 feet, you should evaluate the risk and employ whatever controls necessary that we talked about on our chart. Your shipping and receiving protocols. What does that look like? Your employee transportation protocols. Do you have a bus or a shuttle that brings folks in from your parking lot? What's the disinfection schedule? Is there room and space for social distancing? Have you put signs and markings on that vehicle? Things like that. What does your on-site health screening protocol look like? Are you going to have somebody at the door doing temperature checks? Are you going to ask employees to self-screen? Reporting incidents, self-quarantining, and return to work protocols. What do your isolation protocols look like? All up to you and how you design your program. Signage and markings. Like I said, we have signs all over the office on what spaces can afford as far as people in that area to maintain social distance. Employee training and communication. This becomes super important for obvious reasons. This is a huge cultural change in your facility, outside your facility, getting up from your desk, going into the store, wearing a mask. Huge cultural change, right? And it's a habit. You got to get in the habit of doing it. So training folks how to properly don and doff PPE, having conversations about what's going on, if protocols have changed, if guidance has changed, if your program has changed. So those communications become even more key. Auditing protocols. What does that look like? Are you having your team audit one another? So keep all that in mind as you're growing your program. That these are some key protocols for successful programs. With any program, documentation and administration becomes very important. So plan documentation administration. So documenting your response team and their tasks and their assignments, documenting their schedules and what that looks like, your disinfection schedules and your risk evaluations for employees. Document. So it's up to you what you're going to ask your team to document, but keep in mind that, let's use the disinfection team lead as an example, and a checklist perhaps in your bathroom, locker rooms, lunchrooms, a sign on the door that says this is the last time this was disinfected, provides a level of comfort to your employees and reassures people in your operation that these things are getting done and that they work in a safe environment. Up next, another controversial one, record keeping. So work-related COVID cases are required to be recorded by OSHA. How do you determine if it's a work-related case? Unless you have somebody that's infected an entire work cell, you don't. I go to Target once a week, so I could have very likely picked it up from someone I was in close proximity with at Target or at a retail setting, right? So you don't know. We recommend that you research, get online, find an attorney that's versed in this. There's some great resources online for guidance on if it's a work-related case and therefore reportable. So one of the things to check on is if your business already has a continuity plan in place. Everything I've talked about would simply supplement that. You may already have a program in place for the flu or other epidemic, and this can just add to that and enhance it. So keep that in mind. So just to remember, this is a fluid situation. If we've seen nothing else over the last 6 months, the ever-changing guidance with the increased testing in COVID and antibody testing, protocols change right along with that and right along with those increasing numbers. And until a vaccine is widely available and we can get a large portion of the population inoculated, we're likely to see this continue. So keep that in mind, remain diligent, stay up to date with CDC and other local guidance, stay on the OSHA site, they're updating regularly too. And as always, if you have questions, if you want to reach out, if you just need to talk and lament, this is such a hard time for everyone, feel free to reach out. I'm going to give you my email address and you can contact me with questions. You can contact me to vent. Again, I'm an account manager. I love to talk to people, even if it's myself in an empty conference room. But email address, reach out anytime, and would love to hear from you. Okay, this is my adorable almost 2-year-old. Let me try that again. This is my adorable almost 2-year-old, and I posted this to all my social media accounts with the caption, "If he can do this without complaining, so can you." Here's my email address. It's clee@corner-enviro.com. Reach out to me. I'd love to hear from you and hear what your operation might be doing differently. So that's working. All right. Thanks.